I would say ask a million questions. I know especially at the beginning, it's really overwhelming. So write down questions going into it, write down questions when you get there at your appointments. I would also bring someone with you because your brain is just going a mile a minute. And then write down in this journal or planner or whatever you decide to do, write down all your treatments when they start, write down any side effects and symptoms you might be having, so then you can report them back to your team. Write down any questions prior to your appointment, so then when you get there, you remember those questions. Write down the answers to those questions, so then you can refer back to them. So that way later, maybe your care team, maybe your husband, wife, friends, whoever is helping you, can also refer to this later. So just keeping that journal is really helpful.
It could be very overwhelming at first, not knowing what to do and what's going on, but it's okay to ask questions and let your healthcare team know that you have these questions, and always make sure that you're being heard.
Speak up for yourself. I think that sometimes young adults, we don't really know how to speak up because it's like we were just kids, or, you know, we have all this other stuff going on, or also the shell shock of being sick, right? So we're like, okay, we're gonna go with the first plan someone tells us. It is okay to get a second opinion. If you're not comfortable with a treatment, ask questions. Be like, okay, what does this treatment do to my body? How am I gonna feel tomorrow? Can I go to work tomorrow? Can I even work with my treatment plan? Can I even do regular stuff? Can I have children? I think that we need to have these more candid conversations about, like, what does this do if you do this, and where does it equal me later on in life? Like, just speak up and say, like, hey, what is happening? And if you can't speak up for yourself, have someone else that can for you, whether that's a mom, a dad, sister, brother, caregiver, family, friend, whomever, that can be in that room with you and say, hey, what are you saying to my person? What are they saying? What are they asking you? What are they inquiring? Because you need someone else. Sometimes as we black out as cancer survivors and cancer patients, we're sometimes in such a shock, we're like, well, I don't know what's going on. And have someone else that does, that can tell you, like, hey, this is what the doctor said. Have them be able to translate it to you. Also, make sure your doctors are able to translate the information to you in the way that you can understand. Because that sometimes is a barrier for us as young adults, because we're like, we don't know what you're talking about. But being able to, like, also just continue to ask questions like, hey, what is happening with my body? What are you telling me what is going to happen to me 20 years from now, or 10 years from now, or a month from now? What is the prognosis of that?
Just because we call it self-advocacy doesn't mean you have to advocate for yourself alone. Build yourself a team that will help empower you. Find other AYAs who have been through a similar treatment or who had the same oncologist and get advice or tips and tricks from them. Allocate tasks to friends and family members. Get a therapist who can help you process your feelings and even help you articulate your needs to your medical team. Remember that you have the right to thoroughly understand each aspect of your treatment. More than anything, you deserve to have your suffering minimized and have help with treatment side effects.
Write down what's on your mind, anything and everything. Topics that scare you, topics that bring you joy, topics that you're not sure about. Bring them to life by literally taking pen to paper and writing these things down. For me, writing it down and looking at it kind of just made the monster in the closet go away. I made it real, I shined a light on it, and all of these thoughts, all of this anxiety, all of this depression that was happening inside of my head was no longer just inside me. Now that I was able to write it down, stare at it, look at it, and analyze it from that point, from there I can now put a plan together to manage whatever it is I'm fearing. And one of my favorite things is writing stuff down and reading it to other people, because in the moment I may not be able to express what's in here, but if I write it down and I write with no judgment, write it down, write with no judgment, let me see what happens. And that's been something that's helped me so much. When my body looked very different, when I had no hair, when I had no eyebrows, when I was going through my chemotherapy, writing was my self-advocacy that I could give myself when I felt that I was completely alone. And it empowered me to express myself, to actually find help, and let me set a plan in place for whatever it is I'm feeling in that moment.
I hope it's obvious, but during your treatment, I very much recommend that you put you and your well-being first, whatever that means for you. I'd also recommend learning about your cancer and your treatment, and would suggest that you pay close attention to your care across your treatment. It's really rare, and of course, it's by far the responsibility of your healthcare team, but I did catch and help prevent a few mistakes before they happened by paying close attention to my care.
Speak up and talk to a loved one about your questions, your fears, and your concerns, even if those conversations are difficult or uncomfortable. Alternatively, you can also ask your loved ones to attend appointments with you and have them ask those tough questions on your behalf. This will take a big burden off of you and allows your family member to participate in a meaningful way.
Keep advocating for yourself. Know that it's okay to ask questions. Know that it's okay if you don't understand something and a doctor's got to tell you 1,000,001 times until you get it. Never be afraid to open your mouth and say something. And never be ashamed of what you're going through, when you're going through it, and how you're going through it. That's the best advice that I can give anybody.
Don't be afraid to ask the hard question, even if it's an emotional answer. You be your own advocate. Don't take no for an answer, and be willing to work with family, because you're not alone. No one can take on a cancer battle alone, or even with just one spouse. It has to be a village.
Making sure if something doesn't feel right, either with the chemo or the medicine or anything that you're getting, say something. It might feel awkward, it might feel weird at first, it might feel like you're a bother, because I felt like I was a bother every single time. If it was 2 a.m. and I was sending a message on my chart, to the doctor saying, hey, I'm crying all night because my bones hurt or whatever it is. At first I felt like I was bothering them. It felt like I had to keep it in, but don't. You're not the first one and you're not going to be the last one, and you're the one feeling it, and you have to make sure you're comfortable, because this is extremely hard, and you're already going through so much physically, psychologically, emotionally. It's okay. It's okay to send a message. It's okay to let them know so that things can be done to assist.